office, and this is our courtyard. So when you come in, this is what you see. We call it our Zen garden. This is my cat, one of our mascots. And we live just right next door. And so come on in and see the office. And then this is our OB wall. So these are all of our local awards.
Ocean Beach wall.
Yes. Cool.
I found some gasoline over here. You know that?
Is there a specific award you're most proud of?
Not really. I think the things that I'm most proud of are my old surf posters because they don't exist anymore. We used to have a theater that used to always play all the surf. So everybody that surfs and they see these they always go, oh my God, where'd you get that?
That's awesome.
Yeah. Okay. And this is our reception area and of course our kids' room. And the kids' room has pretty much been decorated from the kids in our area. We do preschool tours, so the preschool kids come in and those are all their little thank you notes. And we've got our Smiles for Life stuff and of course our soccer teams. And
so cute.
even our kids that are teenagers still end up in this room. And then of course we've got our local OB art, because a lot of our patients are artists. So they kind of help decorate our office. And then we've got our bonfire coming up this weekend, so you guys will get to experience that as well. One of our patient appreciation.
We're not on the list of dentists that they have paid to be on the list, essentially. That's what that means.
And then this is also our patient of the month. So we do like a little drawing so everybody gets to be entered. So these are all the people that have shown up to their appointments on time. They've gotten a good score on their periodontal score, or they've referred a friend, or they've written a good review about us. So
that's awesome.
They get an entry every time they do something.
And what do you usually have as prizes?
It kind of depends. We tend to tailor it to the patient, so depending on what they like, what they're into, we have a bunch of different stuff. Like the last one we did edible arrangement, so a bunch of fruit and stuff like that, and she got a tie-dye t-shirt
so cool.
And a bunch of dental goodies in addition to that. And
so cool.
Of course, a note from us. And then we go to their workplace and get a picture with them and
that's
surprise
awesome.
them. Yeah, so like with her husband and everybody else was in on it, so she was really, she's like, how did you find me? Oh, and actually, yeah, that may be one of the other things that I'll share with you guys is we do, because I'm in an area that is a little bit more health conscious, we do safe mercury removal. I also am very chemical sensitive, so we don't have any chemicals in our office. We use like a steam sterilizer instead of...
Yes,
Laura's getting all the parts on him first, getting him dressed up.
Oh.
Yes, so is that what you call
So what is this?
This is Horton.
actually,
Does he look like Horton?
he just needs to be green. But
so
when we take out like mercury fillings and stuff like that, we put it, place it next to the patient so they don't have to breathe in.
And more importantly, we don't have to breathe it in
Right.
because we're doing it all
But
day
it's just
long.
safe.
Oh, wow.
And when we use nitrous oxide, we take this and we use this also.
Yeah.
So one of the things that we do here in our office for our marketing is once a year, or depending on whenever we need to, we send out a newsletter. This year it happened to include the bonfire, the patient appreciation party we have coming up, our new patient of the month program we've started, the new associates that we've added on, and then on the back is our 3-day breast cancer walk that we are doing, and ways you can donate and support us in that. So,
Oh, go ahead. I was just going to say, what are some other things that set you apart, make you unique?
Well, one of the things that we've been doing just recently is on the Crown Council Network, Dr. Jeff Gray was recommending the Dash book. So I actually got the Dash book and checked it out and just fell in love with it. So we've actually been doing that as we go through all of our patients that have been with us 10 years or longer. We make a personal inscription on it, everybody signs it, and then we present it to the patient when they're here. And it's been really fun. I think we probably get more out of it than the patients. And we've gotten, it's funny because it's like we're thanking them for being patients, and then we get these fabulous thank you letters and
that would be
rave reviews from them, you know, about, oh my God, that was so sweet, thank you so much. And so it was kind of neat. It's kind of fun, been fun, and we've really enjoyed it. So that's one of the things that we've gotten out of the Crown Council Network is just stealing from brilliance, because this was absolutely the best idea, and we
What's
love
the
it.
book about?
The book's about, the dash is the little line between when you were born to the time you die. And so it's the time that you spent here on Earth and the lives that you've touched, and it's just a short little poem or story, and then Mac Anderson has taken it and kind of expanded on it, and so it's fun that patients will even come in and say, oh, I've only made it partway through, but wow, it's had such an impact on my life, and they'll tell how just certain words in here just really touched them or really meant a lot to them, so it's been fun. Okay, so this is where we keep all of our scrubs. Everybody comes to work in their shorts and t-shirts, and then we get changed here, so we're all wearing the same thing, we're all dressed alike. We've got everybody, whoever's here first gets to pick out what they want to wear. We've got our Halloween scrubs, because Halloween's coming up for October. And then we've got our breast cancer 3 days, so we're all wearing pink. Even the guys wear bright pink, because we're getting donations and stuff for our breast cancer 3 day. Yeah, we got Christmas, Thanksgiving,
Valentine's
Easter, Valentine's Day, and then just our regular old standard.
And tell about the tie-dyed. We couldn't find any tie-dyed.
Yep, and then we've got tie-dye scrubs, so we made our own scrubs. We got white shirts and then tie-dyed them. So we all brought in all of our stuff that we wanted tie-dyed, and we all went out in the alley and just collected rubber bands from the mailman and made tie-dye shirts.
Cute.
So if you could start your practice over, knowing what you know now, what are some of the things you do differently, some of the things you do the same?
Start fee for service.
I probably would have started out fee for service instead of, but it wasn't that big of, it was a nice easy transition for me. Once I did boot camp, then it made it a lot easier that we were just always so busy that we were able to go fee for service. I've been fee for service since 98, 99, somewhere in there. And then haven't had to go back, which is nice. This economy's been a bigger change for us just because it does. That's why the dash was so nice, because it makes you count your blessings and really look at, you know, who's been with you all these years and values what you do and keeps you in business. And yeah, and we're really blessed to have a lot of people like that who really, you know, like Alice works in other offices, so she comes in and tells us, it's like, she goes, your office is the only place that people don't have bleeding gums and don't have infection and actually care about their teeth and their health, and they're committed to it. And they get upset. Like, we have patients that have competitions between the family.
Spouses,
I think that's the better perio charting. They take a printout home with them and put it on their refrigerator and compete against the spouse.
They'll ask us to sign it to verify that it
Yeah,
really
or
did.
yeah.
Some of them actually have to have
Signature. Yeah.
Yeah.
But I also think the office is really based on positive reinforcement rather than either just not caring about the patient at all, not giving them the time. But I think the one thing that I really do like is that I notice what Dr. Yamada does is she actually sits and she faces the patient and she talks to them like they're people. So I think that helps them get them excited about being successful with their dental treatment, with their dental maintenance.
Yeah, and we make a big deal when they do well. Like they,
Yes.
we
Yeah, we do.
well, and
Cause for celebration.
Patient of the month.
yeah, like even if they do well in their periodontal scores, they get a sticker, they get entries into the patient of the month, because we do.
Get raves, so it's fun.
Yeah, and everybody knows, so we've got headsets, so then it all gets announced over the headset too that somebody just got entered in the patient of the month because they got a good perio score. So that everybody knows.
Bell, ding it everywhere. That would be nice, like the human treatment joke.
Yeah. When someone agrees to their treatment plan, you ring the bell. Yeah.
What's the bell for? Or you'll find out.
Oh, just you wait.
Well, one other thing that makes this office, I think, rather unusual is that whenever we try and discuss things with patients, we try and integrate them more into the treatment process rather than just tell them you need a crown because you have a crack in your tooth or because your gums are bleeding and you need deep cleanings. It's like, what have you been doing differently? What is it that you do regularly or not do regularly? How is your diet? How do you approach life? Have there been any changes? How are you dealing with stress? Try to find out more. Are there any family issues? And try and integrate that into the process of treatment. And I think people feel included rather than just seen as some disembodied object that we're going to make money off of. And I think that means a lot to them when they come in and they feel that. So.
Well, and then we are in an area that it is more of a holistic approach.
Yeah.
You know, we have a lot of people that are more health conscious here. You know, a lot of people do yoga. A lot of people are into kind of their personal growth and development. We have a lot of people that don't eat meat.
All natural.
Yeah, they don't eat.
You know.
They'll do organic. So we've got a lot of, you know, a different lifestyle choice in our area. So we kind of tend to cater more towards that too.
I have another question for you. So, how do you get your patients in the door? What kind of marketing stuff do you do?
We do a lot of the stuff that the Crown Council and Boot Camp recommends. It's like we ask people for referrals. You know, we ask patients, you know, who do you know that could use a good dentist? A lot of it we're out in the community because Ocean Beach is such a small community. Pretty much everybody knows who we are. I have patients that have come in from I think the best referral was the dog referred me. Is we had a Frisbee with our name on it and the dog picked it up at Dog Beach and brought it home. And that's how we got a whole family.
That's awesome.
We get people from the parade. So we have a Christmas parade every year and we all go out and wave and in the parade. So
do you wear costumes or do you just wear your
Halloween or not Halloween?
Sometimes
Christmas
we have it
hats.
It changes every year. We've got antlers, we did our cowboy hats, we've had tiaras, we've got our 2 sweatshirts, we've had...
One of the big draws with that is that we also hand out squishy teeth, like our little grit teeth. And that's a hit with the people who are lining the parade route. They love the squish teeth.
Yes, there is
and that's how we hand them out, even though it's technically illegal to throw it out like that. That's how we do it. We do it anyway, and people love that.
Yeah, and we usually get pictures off that. We participate in the chili cook-off.
The Halloween candy buyback.
Oh yeah, that's one.
Yeah.
We just do everything that happens here in the community. All the social events we try and get involved in.
Oh yeah, we have sundowners. So like our Merchants Association does mixers. So all the different businesses in the area, every month we do a mixer. So everybody goes there. We get free food, drinks, and you get to mingle and get to know everybody. Pass out your card. And so we have patients that way. Yeah, it's just sort of word of mouth mostly.
Constantly making sure also our website is updated, current, just
dabbling in social media.
Yeah, a little bit in social media. The more we get on our website and update it, the more we show up on just general Ocean Beach dentist. So,
and trying to focus our website on how we participate in the community and make it more about us as people and less as a clinical type environment. Even though it's important.
Yeah, and then we still get a lot of referrals also from like specialists.
Oh yeah, a lot of our specialists refer to us for their patients too. That's where we get a large portion of them too.
Yeah, we notice it's rather rare. It's a two-way thing. We don't just refer to specialists, specialists refer back to us as well. So it's rather unusual in that respect. So.